you have a password, how did they manage to get in the meeting?
Francisca, the meeting is open to the public. Anybody who has the link can get on. You just have to be careful about who you allow into the meeting. I made you a co-host. This person in the waiting room, Angiz
I know
Pierzi,
that
is,
person.
I'm sorry?
Remove that person.
Exactly. So what I meant to say is that even people come into the waiting room, you have to be able to gauge and see that this person is probably not a real person and to not let them in, which is what happened. A lot of
Yeah,
people just
because
got it.
you see, I am talking and admitting persons at the same time, and I can't do both one at the same time. So I was just letting in people.
Right. That's a mistake. We can't do that. We have to be able to at least vet to make sure that somebody,
Yeah,
there's a
so
lot of them.
somebody have to let in the persons. Who is Bartholomew? I don't know that person.
Right. It's a fake account. So we remove it and don't admit it. We really have to, be careful with filtering, especially for the committee meetings. For the general board meetings, that's a registration process. But with the committee meetings, they're open. We have to be careful with who we allow in.
Yeah, but if you can just keep an eye on the persons who are coming in, because if I see somebody coming in, I just admit them because
Right.
I cannot filter it
I'll
myself.
monitor
Because
it. I understand.
okay,
I'll monitor. Don't worry about it. Go ahead.
all right.
You can.
Thank you. Whew, that was terrible.
Yeah. I just logged back on just to see what was going on. I didn't know if the meeting would still be on or not. Oh boy.
Yeah.
Karen, can you share your information with us? I really am interested in some of the things you were saying just before we got cut off. And
Yes.
you're in East Flatbush area?
Yeah, we're Flatbush, not East Flatbush.
Okay.
Yes, we're 1249 Northern, right around the corner from Kings County Hospital.
Oh yeah, I'm in the same neighborhood. So,
yeah.
Okay.
Okay. So my question to Jackie, and then I'm gonna come to you, Jackie. Jackie, what do you have working on for the month of January, February, March?
Like I said, January, we're looking at MLK Day of Service with the seniors, just having an intergenerational event where the young people can come out and just kind of cater to the scene, whatever it is that they need. If they need, grocery shopping, laundry help, rearranging their apartments or whatever it is, that they need. But we're playing it by ear because of the spike in the COVID cases.
Yeah.
I did want to say that I think that resource guide that Karima mentioned would be a good idea, not just for COVID resources though, just whatever resources are in the community that people may need to access.
But if I may say that we have, is very extensive, the one that the community board, I don't know if you have ever seen it, but then it has so much that I can't read everything. And Khalid, they do a very good job with that, and with the resources that they put out there.
Right. So then maybe instead of creating a whole new thing, maybe have like an addendum to add to that.
Yeah.
That can be, because COVID can't possibly stay forever. I refuse to believe that this pandemic is going to be like this, for the next 5, 6, 7 years. I don't know. I'm thinking maybe something around food insecurity and nutrition for the community, or something around senior safety. There's been a lot of violence and a lot of different things going on, attacks against our seniors. And I've been working with some of the cure violence groups to start a senior task force, as well as with auxiliary police, to try to get that going and have more of a presence so that our seniors feel safe when they go, to cash their checks, or they go to a check cashing place or a bank or a pharmacy or wherever where they have to spend or use money to ensure that they are safe to and fro. Also, upon release from the hospitals, we have seen a lot of seniors just disappear and no one knows where they are. So how is, I need to know that if my seniors are being discharged, that there's a discharge plan. Who are we discharging them to? things like that. So I want to really try to see what we can put together around senior safety.
Okay, so many of the seniors who are at the senior centers, most of them, they are covered because the senior centers were, keep track of them and they have their names, addresses, and everything in the database. But for those seniors who live alone at home, they are the ones. And one thing that I have been trying to do is to work with the supers, but then a lot of the apartment buildings in our neighborhood, some of the supers, they are non-English speaking supers. So you can have a dialogue with them to, to ask them questions. So I'm trying to see how best it is that I could talk to the persons in the apartment building so they could start a tenant association. So they can keep track, have the names of the persons who, and I think, and some of them, they don't want to because they're afraid, of the building management and stuff like that. But I think it's something good. That's how, because if you have a 3-4-story apartment building, I can go and walk the whole place. But if there's someone in there, and you could start an association in the tenant association in there, then that person, then you can liaison with that person and get the all informations that's needed. Albert, did you? Oh yeah, I think that you wanted to say something.
Yeah, I just want to add that I agree with everything that you said. It's extremely important that there are tenant associations, and I agree with you that a lot of tenants are afraid to start tenant associations because of backlash from management or because of backlash from landlords. I am heading up a tenant association in my building, and I put up a flyer for meetings, and then the next day, all the flyers were taken down. And I'm sure that that's a reoccurring thing throughout the area. But this weekend on Saturday, I'm going to be at the train station. Like this weekend, I'm going to be at the train station on Nostrand and Empire and Nostrand and President, just passing out pamphlets to people to teach them and instructions on how they can start a tenant association. That is phenomenal. Plus, I'll put a video out over the weekend. But yes, tenant associations, we need them.
Yeah, definitely. And you can also send one to the community board and they can put it up, so at least, because I think it's needed. It's needed. And persons who live in apartment buildings or close to apartment buildings, they can get it, and put it up, especially. And the persons that we should really try to get to also are the block association leaders, so those persons then can get, can work with departments. And I have been trying to talk to them. And it is one thing that I'm looking for the board to do this year, to bring all those block association presidents, have a meeting with them, because as I said to them, if I go to an apartment building now and I knock on somebody's door and it's a senior and she look for her people, well, she don't know me, she's not gonna answer her door. But then you have a block association president, they know them, they know the persons on the block, and therefore they will be able to communicate with them best than they would want to talk to me. So we have to bring in our block association presidents and have dialogue with them so that we are able to penetrate those apartment buildings to get the info that we want from them, and then to give them the info that is rightfully needed, that they do need. Anybody else? It's 8 o'clock, and I don't have much for. I know definitely we will look into doing the outreach, the COVID outreach. So it is something that we're going to look into. I wish Miss Enid did come back. I'm looking forward. I mean, 2020 and 2021. Especially 2020, Warren and I, we worked together on that. We were able to give out thousands of masks, maybe over 20,000 masks we were able to give out in the community. And it is something that I would really like to get, if we can do that again, because there are persons out there. So you may see people walking in the streets with masks, and there are persons who are not wearing masks, and it's some persons who have masks. You could tell that they were wearing them for about 2 weeks, and then we gave masks from Nostrand Avenue, from Eastern Parkway to Claxon, and we went all the way to Utica, and we give from there from Eastern Parkway to Claxon, a little before Claxon, and because of how the area is cut off out of our district. And we were fortunate enough that we had boxes upon boxes, and the 71st precinct, they put them, the boxes in the van, and as we were distributed, and some of the officers, they were on the street giving out masks with us, and as we were distributed, we'll just go to the van and we'll get more. So I'm hoping that we can get some masks to, I'm gonna talk to and have Warren to help me with that, and also Miss Waterman, liaison with Miss Waterman and see if Enid can help us also to get some masks to give out in the community. Anybody else have any suggestions before we part, before we adjourn? And another thing that I want to touch before we go, and this thing, it just confused my mind. It was this very ugly. Ms. Brown came to the meeting, and I was hoping that she would have come tonight. And then she has this program, Healthy Eating, in school. So she take the program to the school where she teaches the children and the parents as to how to eat healthy and how to cook healthy. So this is a program that I'm looking for us to really penetrate the school system in our community and do that as well. So that's basically it for tonight. You know my email. I know you have my email. You have my telephone number. So this is one thing for the resource guide. So we will continue with the resource guide that the board has, but then we'll just add more contents to it. And then also we can do the outreach, the COVID outreach, and Miss Smith and Miss Plato, whatever is on Miss Love. So whatever else that you may have that for the quarter, for this first quarter that you're working on, please just rope us in and we'll work together to make it happen. And Mr. Albert, whatever information that you may have and then that you think that we need, you know, to disburse to the community, to our seniors, for the young people, please pass it on. Don't be a stranger. You are stated part of the family. So let's work together and make it happen. I am not looking for negativity. Bad things may come in 2022, but let's take the negative that comes and turn it into a positive, and let's work together.
Sounds good.
Can I just ask a question really quickly? I'm sorry, I won't be long. I just wanted to know if we have ordered or if we have access to the home testing kits.
Not as yet. So we are looking because we're expecting the city supposed to be getting some. So we are looking, and then as anything else, I don't know, some of you would have heard from the president that they're looking to mail testing kits to persons' homes. But then persons went out. I had a meeting today and for my job, and we were talking about the testing kits. They don't really have any testing kits. And I think two persons, Amazon and maybe Walmart, they're the ones who have it, and they're kind of expensive, so they're not purchasing them. But the city will be getting testing kits. So we'll look into that as to how we can get testing kits to our seniors and persons in the community who needs them. And when we have to get information to persons in the community, and it is something that is very important that we really have to get on it to let persons know, because we may say, hey, you know what? We have it on the website for CB9 and we have it posted this place, or it's on the kiosk and everything, but ain't everybody who go on the web, online to read anything, you know? So sometimes we just have to go to them and give them the information. The seniors, some of them, they have the phone, it's just for calling. You don't have any internet or anything that you can go online. So hence, I don't like when people come and then they say, oh, this is a website, so go on the website. We can go on the website, but the persons who really need the information and they need to get to those resources, they are not able to go on a link, open a link to get the information. So it is our responsibility as advocates for the community, for our seniors, and for those who are in need of the service to bring those services to them.
I would like to ask a question and maybe a suggestion. I know in this committee, we've been consulting a lot of the senior. Is there any possibility we could link up maybe with the youth committee to do some stuff, some presentations of for youth health also?
For who?
Youth health.
Yeah,
I mean,
yes. Yeah, so this is, we spoke about that earlier. I think maybe before you came on that we spoke about, Ms. Flato brought up the mental health awareness in May. And then, so we're gonna have a forum for the older folks and have something for the youth as well, for the young people as well. Because it's well needed.
I think we should also reach out to the youth committee. Maybe we'll do something in common. That's the dimension I wanted to add to it. So you have two committees instead of one, pushing one item, one agenda. That's my suggestion.
Yeah. So, and that is a great idea, because if we'll do something for the youth and we have the youth committee and then he already have a network out there, then we can work with him so he can bring them together and then we can bring this information. So that's a good point. Great idea. And also even for the youth, because I had a meeting today with DYCD, and so the youth committee, I spoke to them and I told them, you know, I don't know where they go and who they give information to, but I told them that we have a community board, we have a youth committee, and I would like them to work with our, you know, our youth committee with the information that they have. Our community need those information as well. So we will be bringing them, and they are very happy to work with us. So they will be bringing much information to us as well.
That's fantastic. Yes.
Yeah. So I thank you. I wish that we you know, all the informations that we were getting, you know, this didn't happen, and then it just, you know, everybody run, and maybe they thought that we're not gonna come back on. But Warren, before I close, is there anything you would like to say before we adjourn?
Hi, Brian. Warren has been having trouble unmuting himself. I think it might be a permissions thing on his end. I made him co-host, but he can't unmute and he can't take off his camera, I think.
Oh, so can you remove him as co-host? Because it's not even showing that it's not allowing. Did you? Okay, you remove him as co-host, so maybe he can try. Warren, can you try to unmute yourself now? Oh, okay. So thank everyone. I thank you so much. I'm happy to see everyone that you well. You're safe. Looking forward to seeing you next month. Remember, whatever that you have happening for the month of January, February, March, just keep me in the loop, and the committee, we have to support each other, whatever that you're having. I would like to know, we would like to know, so that we could support and we can be there. So that let's work together and make this thing happen. So Karen, do you have my number?
I do not. I'm looking through my emails. I'm just putting everybody attached to their emails. I don't think I have your phone number though.
Okay, so my number is 917 763 9284.
Okay, I added it. Thank you.
Yeah, so you can send me a text. You could if you will see my email in the chat, so you can send me an email, and I will just, whatever it is, I'll just let the committee know. I'll just put it in the chat, and we will work together. Stay safe, everyone, until we see next month. And remember, we are working out there for our families. We are trying to do good for our community, but remember, self-care. Take care of yourself as well. Stay safe.
Thank you.
Okay. Have a good night, and thanks for coming.
Thank
night,
you.
everyone.
Thank you.
Thank
Good
you.
night, everyone. Until next
Jackie,
time.
we need to talk, Jackie, okay?
Okay, call me.
All right.
have
Oh,
my
wait, I
number?
don't have your number. What's your number?
347
Uh-huh,
691
691
1392.
1392. Okay, thank you.
You're welcome.
Okay, good night, everyone.
All right.
Good
Bye-bye.
Good
night.
night. Good night.
Bye.
Bye.
Bye.